I'm going to talk about 7 supplements that can actually improve your teeth. People think brushing and flossing are enough for healthy teeth, but what if I told you that some of the biggest drivers of cavities and gum disease start inside your body, not on your toothbrush? Today, I'm going to show you 7 supplements that can dramatically improve your oral health. Some of these are backed by real clinical research, and they may surprise you. And one of them is something dentists wish more patients used every single day. Most dental issues come down to 3 things: the oral microbiome, inflammation, and the mineral balance in saliva. If those 3 are off, no amount of brushing will fully fix the problem. Think about it like this. Your mouth is an ecosystem, and what you put in your body can either feed the bacteria that destroy teeth or the ones that protect them. So, the first supplement and the most important one is xylitol. I don't know if you've heard of it. It's an important sugar. If there is one supplement with the strongest evidence for preventing cavities, it's actually not a pill, it's xylitol. And xylitol is a natural sugar alcohol that bacteria cannot metabolize. So when a cavity-causing bacteria tries to eat it, they literally starve. And research shows that people who use xylitol after eating have fewer cavities, lower levels of Streptococcus mutans, less plaque formation, and the key is multiple times per day after meal. Chewing gum or lozenges work best. So the second supplement, which is the most people are deficient in, is vitamin D. We don't get exposed to sunlight, and that's where we get our vitamin D. So low vitamin D is strongly linked with cavities, gum disease, bone loss around teeth. Vitamin D activates antimicrobial peptides in the saliva, and it helps control harmful bacteria. It improves calcium absorption, which strengthens enamel and jawbone. Many adults are walking around with levels that are far from optimal. I could say I found that I had very low vitamin D, and I started using the supplement and I felt a whole lot better. The next supplement is the oral microbiome fix, the oral probiotics. Not all bacteria in your mouth are bad. In fact, some bacteria actually protect your teeth. Certain oral probiotics have been shown to reduce plaque, even improve bad breath, improve gum health, compete with cavity bacteria. And what we want to look for strains like Streptococcus salivarius and K12 and M18. Those are bacterial strains that are designed specifically for the mouth, and you got to look for them when you're looking for that supplement. Check out what type of bacteria is in the probiotic. Now, the next one we're going to talk about is CoQ10. This is a supplement that many cardiologists recommend, but dentists never talk about it. CoQ10 helps power the mitochondria inside your cells. Your gum tissue has very high energy demands. Research has shown that CoQ10 can improve gum inflammation, healing after periodontal treatment, tissue repair. It's particularly helpful for people over 40. We've also got a supplement that helps with inflammation. Omega-3 fatty acids. Those are also recommended by cardiologists, but they also help with gum disease. Gum disease is caused by inflammation, and it's an inflammatory disease. Omega-3 fatty acids reduce inflammatory cytokines in gum tissue. Some studies show improved periodontal pocket depths and bleeding scores where omega-3 are added to treatment. This is one of the few supplements that can help both heart health and oral health. You get 2 in 1. Now, this next one is a forgotten one. It's vitamin C. You only remember it when you're thinking of your immune system. Well, believe it or not, we talked about gum bleeding and we talked about inflammation. And when your gums bleed, you brush, and this might be a clue that vitamin C is critical for collagen production. Without enough vitamin C, your gum tissue becomes fragile and inflamed. Historically, severe deficiency caused scurvy, and that was well known on sailors in the sea. But even mild deficiency can contribute to gingivitis. So get your vitamin C and you'll feel better. Now, there is some emerging supplements that are beneficial, or some evidence has shown that they may help, that are being studied, like lactoferrin, green tea extract, curcumin, and acetylcysteine. These can help disrupt harmful biofilms and reduce inflammation. Research is still developing, but the early data is promising. So if you want to optimize your oral health, think beyond brushing. Support your mouth from the inside by top quality supplements. My top daily stack would be vitamin D, omega-3, xylitol after meals, oral probiotics at night, and at the end, if you like this video, hit like. If you found this helpful, subscribe, because I break down the science behind dentistry, longevity, and whole body health. And remember, your mouth is connected to the rest of your body more than most people realize. And check this other video.